Chapter 5 discusses CPR, or cardiopulmonary resuscitation. So when somebody has a heart attack or cardiac arrest, this is the first approach we use to try to attempt to save them. A heart attack happens when the heart muscle doesn't get enough blood supply in part of the tissue, or all of the tissue can die. Cardiac arrest happens when the heart stops beating. So for when if somebody has had a cardiac arrest, there is a chain of survival, 5 events that have to occur rapidly to make sure that this person is treated as quickly as possible. Seconds count. First thing is the recognition and activation of the emergency response system. And you have to then begin immediate high-quality CPR and rapid defibrillation with an AED if needed. Lay rescuers can do that. Anything, advanced medical services, you need the EMS that probably transported to the emergency department, and advanced life support and post-arrest care occur either in the cardiac cath lab or in the intensive care unit where they may be if it's serious enough. The purpose of CPR is to move blood to the heart and brain. You do that through compressing the chest and also giving periodic breaths to replace oxygen into the person's lungs because they're not breathing on their own. This can save a life, but again has to be done in the very first few seconds. The sooner the better. When we classify ages, an adult is considered puberty and older. Children are 1-year-old to puberty, and infants are under a year. And there's different methods for treating whether you are an adult, a child, or an infant. First thing to do, regardless of age, is to check for responsiveness. Tap the person's shoulder, ask if they're okay. If they don't respond, they're considered unresponsive. At that point, you have to activate the EMS system, so call or ask somebody to call 911. Keep the mobile phone by your side. If you don't have a phone, you need to go find a phone, call 911 and get an AED. If you're alone with a child or infant, give CPR for 5 cycles before you call 911. Check for breathing for 5 to 10 seconds by looking for the rise and fall of the chest. You can give chest compressions by performing this on a flat surface. For an adult, you want 2 hands used and compress the chest for at least 2 inches. Child, use 1 or 2 hands and compress about 2 inches. And for an infant, all you need is 2 fingers and compress about 1.5 inches. You don't want to crush the infant's chest, so you need to use more caution. Place the hands in the center of the chest and give about 100 to 120 compressions per minute. You need to make sure that you open the airway, and you can do that using the head tilt chin lift maneuver. Place one hand on the person's forehead, the fingertips of the other hand on the bony part of the chin. Lift the chin up to tilt the head back. Give rescue breaths. Keep the person's airway open with the head tilt chin lift maneuver and begin rescue breaths. Pinch the person's nose shut, take a normal breath and blow into the mouth for 1 second. Then breathe yourself before giving another 1 second breath. If you see that CPR is working, you want to continue doing that until the AED arrives if needed, and then until the person shows signs of life. Obviously, if they're coming back to life, you don't have to keep doing those compressions. And you continue CPR also until you see EMS arrives and those personnel can take over. Or if you become too tired to continue, you can pass it off to somebody else who's trained. So those are the issues, that you would continue CPR until any of these would occur. There's different methods of rescue breathing. You can do mouth to mouth, you can do mouth to mask, or mouth to face shield. Many people that are first aid providers carry a shield or a mask with them to avoid contamination. And so that's it for the first part of Chapter 5, and we'll continue more on CPR in Part 2.